Thanks, everyone.
Hi, everyone, and welcome to the CareMessage and American Cancer Society webinar. We're just going to give people a couple more minutes to join, so we'll get started in a couple minutes. Okay, so I'm going to go ahead and begin today's webinar. Welcome everyone to Supporting Underserved Communities of Color During COVID-19. This is a webinar in combination with CareMessage and the American Cancer Society. We are really excited to be partnering on today's webinar. We have today with us, my name is Arit Mohammed, and I'm a product manager at CareMessage. We are joined today by Dr. Rose Kokoza, who is the Clinical Director of Community Health and Equity for Primary Care and Community Medicine. And we also have the CareMessage Director of Product, Nina Parikh, and we are going to be the speakers during today's call. Today's webinar is the first installment of a series of webinars that we will be hosting to address racial and ethnic disparities in healthcare, which have been heightened during COVID-19. Today's webinar is meant to be an overview of health disparities, and we hope to dive into topics deeper at our subsequent webinars on specific patient communities. Our agenda today will consist of introducing you all to CareMessage, an explanation of health disparities, considerations for engaging patients, and an overview of our product offering. We'll also have time allotted for Q&A. If you'd like to ask questions, please use the Q&A feature within Zoom. And if you have a question for a specific speaker, please also include that. We are recording this session and we will be sending it out to all attendees. CareMessage is a 501c3 nonprofit organization, and we are dedicated to improving health outcomes for underserved populations using mobile technology. We are the first and only patient engagement platform that is built especially for safety net providers and underserved patients. We work with over 200 safety net providers across the country, and we have reached over 30 million patients. We have an extensive focus here at CareMessage on addressing health disparities that exist for patients of color and also on their health outcomes. Today, we're really excited to have Dr. Kokoza with us, so I'm going to now pass the mic over to her, and she'll be giving us an introduction to the social.
Thank you. As we begin this important discussion about how racial and ethnic disparities and health outcomes and the role that CareMessage can play in addressing them, we wanted to call out the critical importance that social determinants play in driving those disparities. The image that you see provides a helpful framework for understanding how social determinants drive racial and ethnic disparities in health outcomes. As we think about health disparities in healthcare, we often think of healthcare systems first. And while clinical care is critically important, it's not the entire part of the equation. It's only one of the many factors that need to be considered. So as we think about what's driving racial and ethnic disparities in health outcomes, we have to look upstream, starting at the bottom around the policies and programs, specifically health policy, economic policy, environmental policy, and the social policies and programs that create the conditions that produce key health factors that drive the racial and ethnic disparities in health outcomes that we see. So when we look, it's not just clinical care. There are other factors, including health behaviors, social and economic factors, and physical environment that are all connected and driving the disparities that we see. So for example, if you live in a high crime neighborhood, it'll impact your ability to adhere to a good diet or to exercise. And so while there are certain percentages that you'll see listed on these slides, they're somewhat arbitrary because these factors are inextricably linked. So as we move forward in this discussion, hopefully this provides a helpful framework for understanding how these critical factors that you see listed on this slide contribute to the racial and ethnic disparities and health outcomes that we're seeing today.
Great, thank you, Dr. Kokoza. So now that we understand the role of social determinants of health, let's spend some time talking about why certain communities are disproportionately impacted by a set of social determinants that are detrimental to their health. It's really important to state that systemic racism plays a role in who has access to health, who stays healthy, and how long people get to live. So I wanted to share some statistics that highlight how communities of color are disproportionately impacted by health disparities. A study by the CDC showed that Black people are more likely to reside in inadequate housing where exposure to toxins and other environmental hazards are high. The diabetes death rate from 2014 to 2017 was highest among non-Hispanic Black adults and lowest among non-Hispanic white adults. Non-Hispanic Blacks had the highest age-adjusted prevalence of obesity, followed by Hispanics. And we also know that Black people have a higher risk for hypertension and hypertension-related complications, strokes, diabetes, kidney disease. Childhood asthma is directly linked to living in historically redlined neighborhoods, and this topic is actually something we'll be exploring in the next slide. Ultimately, racial segregation, racial prejudice, legal and illegal discrimination are all factors that have negatively impacted the social determinants of health for communities of color, leading to the disparities that we see today. So in order to further illustrate the relationship between structural racism and health, we'll be talking through asthma as an example of how communities of color are disproportionately impacted by a set of social determinants that make them less healthy. Racial segregation was very legal and normal in American society, and it meant that separate towns, hospitals, jobs existed for white people and Black people. Often referred to as the Jim Crow era, racial segregation became deeply entrenched into the fabric of this country. Segregation in schooling was deemed unconstitutional in 1954, but many of the Jim Crow era laws persisted until 1965. Racial discrimination in housing in particular progressed, as did racist values. Redlining is a term that is used to describe a set of discriminatory housing policies that led to starkly segregated neighborhoods. After the Great Depression and the rise of mortgage loans and housing policies that helped build the American middle class, the federal government created color-coded maps that told banks where they could and could not give out housing loans. The red sections where Black people lived were deemed too risky. Ultimately, Black people seeking out mortgage loans were unable to receive them, lowering the property value in Black neighborhoods. Redlining was deemed illegal in 1968 under the Fair Housing Act. However, racial discrimination in mortgage lending persists to this day. and some banks have used red line maps as recently as 2015. Ultimately, this left Black neighborhoods extremely resource deprived, as property value is often tied to many social determinants of health. So many of the same neighborhoods that were redlined in the past are still majority Black and brown neighborhoods, and they currently have the poorest air quality today. So majority Black neighborhoods are more likely to be located near sources of pollution. Historically, red line neighborhoods also exhibit much higher amounts of diesel particulate matter in the air. And so the same communities who were forced to live in these neighborhoods then deal with higher rates of asthma. So this is a clear example of how large of a role that racist policies can play in impacting the lives and wellness of communities. Communities of color were victim to racist policies that then forced them to live in environments and housing that is detrimental to their well-being. And we also know that respiratory conditions such as asthma make people more susceptible to COVID-19, which explains why we see such disparities in race. So as safety net providers, I'm sure you all are aware that the communities you serve are vulnerable to this virus. COVID-19 is highlighting and revealing much of what we already knew about health disparities in a drastic way. With regards to the Black community, we've seen really stark death rates. So in Chicago, 29% of the population is Black, but Black people make up 70% of COVID-19 deaths. Similarly, in Milwaukee County, 81% of COVID-19 deaths are Black citizens, but 26% of the county's population. Similarly, in Louisiana, 32% of the population is Black, but 70% make up COVID-19 deaths. The Native American community is also faced with a particular set of challenges. So after New York and New Jersey, Navajo Nation actually has the highest infection rate. In Arizona, Navajo Nation only makes up 5% of the state's population, but 20% of deaths. It's also important to note that 30% of Navajo households have no running water and 40% have no electricity. In New York, Latinos are dying at a higher rate than any other group, making up 26% of the deaths, but only 19% of the population. And nearly 5 in 10 Latinos in New York City reported that either they or a household member lost their job because of coronavirus. So now that we've addressed a lot of the historical, structural, and social forces that impact health disparities, we wanted to spend some time outlining considerations for engaging underserved patients. A lack of infrastructure for telehealth is a big one. So this graph here to the right illustrates how the attendance of appointments decreased after telehealth implementation among Black, Latinx, and Asian Pacific communities. We also know that comorbidities are seen at a higher rate within communities of color because of chronic conditions such as diabetes and obesity. And other challenges include screening rates, mistrust, fear, and lack of resources for undocumented and mixed status families, language barriers for non-native English speakers and those with limited English proficiency, and also lack of treatment options and availability. A big part of engaging communities of color is acknowledging the unique challenge that patients from various racial and ethnic backgrounds face. So although many safety net patients share experiences due to income, it's really important to address that intersections exist between income and race and ethnicity. So some things that you can do at your health center to help combat this is prepare a tailored communication strategy for different subsets of your patient population. You can provide support for underlying conditions like diabetes and obesity, especially in the form of patient education during this time. You can also help patients prepare for the transition to telehealth. The CareMessage co-founder and VP of Product, Cecilia Corral, actually made these really great informational videos in both English and Spanish explaining telehealth to patients, and you can access these for free on our YouTube channel and send them directly to your patients. You can also direct and activate existing resources for rent, food, medication, and financial help. The CareMessage team has created a free library of messages that you can send to your patients that address many of these topics. Text messaging is the most accessible tool that you can use to reach your patients. So breaking down barriers that exist for patients of color regarding access to health-related information is more important now than ever. Some specificities here, especially for these communities. So the Black community, one thing you can do is advocate for your patients that come into your health center and ensure that their symptoms are believed. Unfortunately, there have been many studies that show that Black people's complaints of pain or symptoms are oftentimes less believed than their counterparts. And so advocating for your patients and breaking down some of that mistrust is really key. You can also work within your health center to talk about implicit biases. For the Native American community, the Center for American Indian Health has developed specific materials for COVID-19 for tribal use that you can access at this link. And for the Latinx community, providing information in Spanish is really important. Unfortunately, many places are only giving COVID-related messaging in English, so making sure that that content is translated and provided to your Spanish-speaking population will make a huge difference. And also providing resources for immigrants. I will now be passing it over to Nina Parikh, who is our Director of Product at CareMessage, who will be going over some of our responses to COVID-19 and taking you through a demo of our product.
Thanks, Arit. Okay, I'm gonna share my screen now. Okay. And can you see my screen, Arit?
Yep, looks great.
Awesome, thank you. Wonderful. Well, yeah, so I'm gonna talk to you all a little bit about kind of our response to COVID-19 and maybe some resources that hopefully will be helpful to you all. So when COVID-19 started to impact a lot of the health centers we work with, our first step was to really think about how we could bolster our efforts at CareMessage to better support health centers, both the health centers we currently work with and potential health centers that that are ones that we haven't worked with before. And so we created a dedicated COVID-19 task force, which is kind of an interdisciplinary group of employees on our team that really are trying to think about ways that we can stay on top of where our health center needs are and anticipate the potential needs in the future and develop the content and offerings that would better support you all. We also strengthened our partnerships with the National Association of Free Clinics and the National Association of Community Health Centers. We created free COVID-19 messaging content that Arit mentioned briefly, and I'll go into more detail about in a later slide. That's free to you as of today. So after this call, you can access all of that content for free now. And we're also excited to announce that we have a free 60-day, you can have a free 60-day use of CareMessage, what we're calling CareMessage Lite. We've been offering this since, I think, March. And since March, we've had 98 free clinics and FQHCs with over 1.4 million patients sign up for the CareMessage Lite and start messaging their patients around COVID-19. And overall, we have around over 190 health centers that have sent over 9 million messages to patients about COVID-19. And so you can see the map on the right. This is highlighting all of the messages that have been sent about COVID-19 by state. It's just a really important time to effectively communicate with patients, especially underserved patients, communities of color during this time. And text messaging is a simple technology, but it's really effective and can be powerful in communicating with patients during this challenging time. So CareMessage Lite offers 4 features. One is outreach, and this is our one-to-many messaging feature. It allows you to message thousands or hundreds of patients at a time. And you can send questions to patients and receive their responses, or you can just send a no response message to patients, letting them know that something has changed at your clinic. We also offer a messenger feature or a chat feature that allows you to communicate one-to-one with a patient and have a more personal conversation with them. You also have the opportunity to group patients. So taking that tailored approach to patient communication, especially when thinking about communicating with underserved patient populations, is really important. So as you think through like what a campaign or a communication strategy looks like for certain groups of people, you might want to kind of segment those groups of people in CareMessage, and you have the opportunity to do that so you can effectively communicate with them on our platform. And then you'll have access to the file center, which allows you to upload all of your patients into CareMessage. And then you also have access to our message library. So this is accessible to you today. You don't have to sign up for CareMessage to have access to these messages. Right now we have about 60 messages in our COVID-19 library. And you can go to that link and see all of the messages. And they range, in topics. So anything from hand hygiene, social distancing, whether or not your clinic has testing available, or whether it doesn't have testing available, where to go to get tested, if you have clinic closures, providing social or emotional support to your patients is really important, and we have a lot of messages around that. And then also pointing patients to appropriate resources, so food or housing or financial resources. And those messages all come in English and they all come in Spanish. The Spanish translations have been done by Cecilia, our VP of Product and co-founder, who's a native Spanish speaker, and reviewed by a Spanish speaker who also is a native Spanish speaker and has a certificate, a medical interpretation certificate from CCHI. They're all written at a 6th grade reading level or below. We try our best to make sure that this is information that is easily accessible to everybody. And then you also have the ability to personalize these messages. So, we have the standard template there for you to copy and paste from in the message library, but you can obviously add your own clinic name, you can add your own phone number, you can create your own local links to websites, and you can just personalize them in however you see fit. If you do sign up for CareMessage Lite, 8 of these messages come preloaded into your account. So you can easily just, with one click of a button, it'll auto-populate the template for you. So you can send it out. And we're constantly updating this message library. So highly recommend kind of checking in maybe on a weekly or bi-weekly basis to see what new messages have been added. We're trying to stay on top of what we're seeing happening in our health centers and creating content that resonates with patients. And then in addition to that, we also have the telehealth tutorial videos for patients that Arit had mentioned. They also come in English and in Spanish, and they're really short. They're like a minute, 2 minutes, 3 minutes long. And they take patients through the steps of telehealth. So explaining what is telehealth, how do you prepare for your appointment? And then we have specific videos around Zoom and Doxy.me on actually training patients on how to use that app. So recommend checking it out. You can also send patients links to these telehealth videos in the text messages you send out. So if you want them to be prepared for a visit or want them to know more about telehealth before their visits, you can easily send the links out there. So here's some examples for how you could potentially use outreach. We know that social and emotional support is really important for patients, feeling connected to their provider, feeling like they can, trust their provider's thinking about them it's really powerful. And so sending a simple message like, we care about your mental health, we know this is a stressful time for many of our patients, and explaining maybe what you're offering to patients during this time, if it's, a virtual meeting, if it's a phone call, you can definitely add in whatever local resources or whatever your health center is able to offer. You can talk about testing. We are or we're not testing for COVID-19. If you think you have COVID-19, here's what to do. Also providing those local resources. So if you or someone you know is an immigrant, we have resources for you. Learn more about them here, specifically geared towards the challenges with coronavirus, or asking patients, do you need help with food or housing during the coronavirus shutdown? You can contact us. You also have the opportunity to survey patients in our outreach feature. So you can ask them about telehealth. Like Arit mentioned, it looks like the statistics are showing that certain groups are not actually attending their telehealth appointments. And so, making sure that we're providing the education needed to make sure that patients feel comfortable with this new method of care is important. So you could also kind of survey your patients, letting them know, like, we're offering telehealth appointments, which option would you prefer? Voice call or video call, or are you okay with either? And then you also can plug in, what response you want to send out when a patient says A, B, or C. And some of these already exist in our message library. So again, these are free for you, and you can copy and paste, and then you can also use them in CMLight. Okay, so now I'm going to show you a quick demo of CareMessage Lite. So you'll first go into, let's see if I can get this. Move over. So you'll go to caremessage.org. You'll see the login on the upper right-hand corner. Okay, click log in, and then you'll sign into the web app. And the first thing you'll want to do when you sign in is probably upload your patients. So I'll go to File Center, and I will click on Upload File. And this is where I would choose the file to upload. So before this, I would download a file from my EMR, and then I would just simply upload it here, and I can show you what file might look like. MRN, patient first name, last name, phone number, and the language preference. You can also add a lot of other demographics to this as well. Date of birth, race, ethnicity. So you can, again, group those patients in more meaningful ways on our platform. So you choose the file, and then it would take you through a couple steps to make sure our app is actually mapping those fields correctly. And then it'll be verified, and you'll be done. You'll have all of your patients into CareMessage. And from there, you'll want to message your patients. So we can go to Outreach, and we can create a new outreach. You'll select the patients that you want to add to this outreach. So this is the opportunity you have to filter patients. So if you only wanted to send a message to patients over the age of 60, you could filter that here, or only patients who spoke Spanish. Or if you had grouped patients, you could also select which patient group you wanted to message. So you could easily select any group for your communication strategy with certain groups. You could select them there and click apply. But for the sake of this demo, I'm going to select all of the patients, and I'm going to add them all. Then you want to move to the outreach information section, where you'll enter the actual content of the message. So here you have the opportunity to select from one of our templates. So we can look at some of the COVID-19 templates. We have the guest limit. So if you have an upcoming appointment to protect staff and patients, we have set a limit on the number of guests to 1. Or you could do the social distancing, practice social distancing and stay 6 feet away from others, refrain from hugs and handshakes. If you're at risk, stay home. If you're sick or at risk, stay home. So you can use one of the templates, and these will come, 8 of them will come preloaded into your CMLight account. You also have the opportunity to not use a template if you want. So I'll show you what that looks like. So let's say I didn't want to use one of the templates. You could type in your own. So I'll type this food security. And you can send it via text or via voice. If a patient has a landline, then it'll send via voice. If they have a mobile, it'll try to send via voice or via text. And I'll make this a yes or no question. And so for this, I'll say, hi, this is CareMessage Clinic. We know this is a challenging time for many patients. Are you in need of food? Text yes or no. If the patient texts yes, we're happy to provide resources to you. See here. You can provide a link to local resources or call us at whatever phone number. And then if the patient says no, thanks for your reply. If your situation changes, please let us know. All right. And then you'll also see that the Spanish field populates as well. And it's really important to make sure that we're trying to communicate to all of our patients, and filling in the content in Spanish is really important as well. So that's why our COVID-19 message library has the messages in English and in Spanish. And so if you use one of those messages, you can just copy and paste from the message library. If you need help with translations, we know this is really important for our Spanish-speaking patients to receive this health information. We're happy to, assist with some of those translations as well. So if you sign up for CMLight and you need help with some of the translations, please reach out and we can see what we can help with. And then you're ready to schedule. So you can say, I want to send this out tomorrow, 9:31 a.m. And then you would click create. You also have the ability to save this as a template as well. We get a lot of questions around languages, and so I'll take this opportunity to talk a little bit about that. Currently, CareMessage officially only supports English and Spanish. We know our especially vulnerable patient populations speak more than English and Spanish. So you can fuel different languages through outreach using the English field. So if you upload patients and they speak a different language, you can group them and then upload that group to this outreach message and send them a message in their native language or their language preference, and just fill it into the English field. We just officially can't officially say we support that because we haven't tested that rigorously, but we've definitely had a lot of health centers use us in that way. And especially through our messenger feature, we've seen a lot of communication in different languages being used. So just wanted to mention that here. Okay, so then it's scheduled and it's sent out. After it's sent out, you can go back to the outreach page and you can see all the outreaches that have been sent. And if you wanted to follow up with any of the patients, you could go into that outreach. So I'll just pick the telehealth example here. You can see this is the telehealth survey question we sent out, and you can see some of the stats show up on this page. And then on the patient tab, you typically, people are sending outreaches to hundreds or thousands of patients. So you could filter by a patient name if you wanted to see their response, or if you only wanted to see patients who responded with A, B, or C, you could filter that as well. And you can see the individual conversations happening here. You also have the opportunity to download this information into a CSV file. So you can download the outreaches and that'll have the information on exactly what the responses were to the questions. And then the last feature I'll show you is the messenger feature. So this feature is our one-to-one feature. So you can, it's just like texting a friend, but you're texting patients from our web application, and you bring up a patient. So we'll bring up Francis. And you can say, like, with this, for example, with the food security question I had asked, maybe Francis responded and said something like, yes, I need help with food, but I also need help with housing. And you wanted to start a conversation with Francis to learn more. So you could start the conversation here. Hi, Francis. This is Nina from CareMessage Clinic. I wanted to reach out about housing resources. When is a good time to call you? Or can you call us at this number? Or you could tell Francis, you know, please go here to see resources that might be available, might be helpful for you. And so this has been, we've seen a huge increase in the number of and in the communication that's happened in our messenger feature since COVID-19. So a lot of health centers taking a more personal approach to patient communication, which I think is really effective during this time as everybody's individual needs are changing and are so different. So that is the messenger feature, and I think that's all I wanted to show for the demo today. Let me go back to the slides here. Okay, great. So then in order to sign up, you go to caremessage.org and you complete the form, and there's a quick onboarding experience, and then you can start messaging your patients right away. I wanted to just reemphasize this is free for 60 days. There's no long-term obligation. There's no form of payment collected. And I'll show you a little bit about what that looks like. So you can go to our homepage and find out more about CMLight, what we offer. You can see the map, who we partner with, and then this video that kind of goes over a little bit more about what I demoed today. This is the free COVID-19 message library. So if you wanted to look at that library right after this call, you could easily access that. And then down here is the form. And once you fill out this form, then someone from our team will get back to you and we can have conversations about getting you started. I believe that's it. Before we jump into Q&A though, I do want to just take a moment and really thank the American Cancer Society for just giving us this platform to speak on today and amplifying our voice. Thank you to Dr. Kokoza for your presentation on the slide on social determinants of health and just providing a rich context for how we are where we are. And then I want to thank each of you today so much for joining. I think we had like over 150 people come to the call today, and I know everybody's time is really valuable. This is such an important topic, so it's really inspiring to see this many people join to hear more about health disparities and learn more about how to communicate effectively with certain groups of people. And just also have to give a shout out to all of the healthcare workers on the call, or everybody on the front line supporting our patients. We're just so grateful for the work that you do and are just hopeful that we can continue supporting you in any way we can. So thank you. And then, yeah, I think, Christine, if there are any questions, we can start tackling those.
Sounds great. Thank you, Nina and Dorit and Dr. Kokoza. Good morning and good afternoon, everyone. My name is Christine Chang. I'm the Strategic Partnerships Manager here at CareMessage. I've seen your questions come in, and we're prepared to answer. And for those of you, if you haven't submitted your question, please feel free to do so via the chat or the Q&A functionality. If there is a speaker that you hope to address and hear from specifically, please don't hesitate to include that as well. And you'll see that CareMessage, as part of this webinar series, we continue the conversation next week, exploring culturally dexterous care and the digital divide during COVID-19 and the impact on Latinx patient communities. We're excited to have Dr. Gezra Ortega and Dr. Jorge Rodriguez presenting and having a facilitated panel conversation with our team. We will share the registration link for that after today's call, and that will all be sent out via email, including some of the resources that were mentioned. So want to reiterate that we'll send out the resources and the recording to this presentation. And with that, we'll address the first question that actually came in via the Q&A chat. Does CareMessage have any resources for getting patients comfortable with Helo? That's eClinicalWorks video platform.
I can help answer that. We don't have any resources for this particular application yet. We also have noticed that this app doesn't have Spanish language availability. So for any of you that are working with ECW and would like for us to kind of help you craft some content around that, if you do get signed up for CMLight, we're more than happy to help support you in that process.
Thank you, Arit. Another question that came in from Rosamar, are there different interfaces for different employees to access?
Yeah, so CareMessage is a web application, so you have full control over which team members you add to log into your CareMessage account. So each health center would have their own account with several team members within that. We also have different permissions available for different team members. So you can add someone as a staff supervisor or as a staff member, and staff members can have limited functionality. But overall, you get to choose who on your team would have access to your CareMessage account, and you could then invite them within the app, and they would be able to set up their own password and log in to be able to create messages or view responses to messages.
Great, thank you, Arit. We had a question from Melissa on text and voice capabilities. The question reads, if you select text and voice, will the system be able to determine if it is a landline, or do we need to specify that it is a landline in the patient's profile?
Yeah, so ideally it would be great if you had information on which numbers you had were mobiles and which were landlines. The patient profile in CareMessage has a space for a mobile number as well as a landline number. But we also have a feature within CareMessage called automatic reclassification. So when you upload your patient data, we can actually take a look at those phone numbers and reclassify them on behalf of your patients. So depending on which phone number is added for the patient, it'll either default to text or default to voice.
Great. Another question on what phone number do the CareMessage messages come from? Is it a random 5-digit phone number, or does each organization get a custom phone number?
Yeah, that's a great question. So when you set up your CareMessage account, we use your local area code, which will then generate random phone numbers. So each phone number that is used to message your patients will have the same area code as your health center, but essentially the rest of the phone number is a randomized long code.
Great. We had a question from Colleen on if messages integrate with and into an EMR, and related to how CareMessage interacts with the EHR or EMR. We have a question from Andrew on, does CareMessage utilize numbers and emails already on the current EHR list, or do they have to be uploaded?
Yeah, so these are two pretty similar questions. With regards to CareMessage Lite, we are not offering full EMR integrations. So the goal with CareMessage Lite is really to get you up and running as soon as possible so that you can message your patients about COVID-19. And that would mean using our more manual process of the file upload. So for CareMessage Lite, you would have to export your patient data and then upload it into CareMessage. But if you wanted to explore CareMessage as a long-term text messaging tool for you and your health center, we definitely offer integrations with several EMRs, and we support integrations with EMRs for our outreach and our appointments feature, but that's more of our full product offering. So if that's a conversation that you would like to have with our customer success team in the long term, we could definitely help facilitate and support that. But in the short term for CareMessage Lite, which was demoed today, we do not offer the EHR integrations, namely because those take a while to implement. And so we would want to streamline the process for CareMessage Lite so you could message your patients as soon as possible.
Great, thank you. How does CareMessage comply with HIPAA regulations?
So for HIPAA regulations, CareMessage is HIPAA compliant in the sense that our web app is encrypted. So you can store patient data in our web app. But when it comes to sending text messages to your patients, we are of the belief that when a patient provides you with their phone number, they would like to be contacted. So as long as you are not sending very personal, private health information over text messaging, you will not be breaking any HIPAA compliance. So a lot of these general health messages about COVID-19 resources, about hand washing, about other resources that you would like to provide to your patient are definitely all HIPAA compliant. So we sign a BAA with all health centers that do get set up with CMLight. So all of that is addressed.
And we can
Thank
also
you,
send
Ari.
out, oh, sorry, I was just going to mention, we can also send out, if anybody has more detailed or specific questions about HIPAA compliance, we have a technical overview document that we are happy to share about this.
Thank you for the addition, Nina. We had one question on the use cases for CareMessage from Colleen. Has this been used to communicate diabetes education messages?
Yeah, absolutely. I think even in the demo, you could see we had a group that was created for Tuesday Diabetes group. So we do a lot of messaging around chronic conditions, and that was and is still part of our main focus. Obviously, with COVID-19, we've been trying to create more messages that are specific to the most challenging issues at hand today. But we have a type 2 diabetes text messaging program that's not part of CMLight, but is a part of our full product offering. And so our programs send text messages to patients 3 to 5 times, about like 3 times a week for up to 6 months around a chronic condition or a topic. And it helps educate patients about their chronic condition. So we do have a type 2 diabetes program, and if that's of interest, we have one-pagers and some sample content we can share about some of our programs that we offer. You can also fuel messages about type 2 diabetes in our outreach feature as well. So you can take some of our program messages and copy and paste them into outreach if you're looking for a more short-term solution. But having patients connected to their care during this time is really important. And so I think text messaging programs that allow patients to kind of monitor their chronic conditions during this time where they're maybe not able to go see a physician in person could be really impactful.
Thank you, Nina. And somewhat related to other use cases and other messaging use cases, Jessica asked about local resources and wanted to clarify if we would help make local resources available. Otherwise, could you speak a little bit to how a health center might be able to share those via CareMessage?
Yeah, so I mean, there's placeholders for a lot of the local resources. So I think that we have in our template, in our COVID message library, some of the national resources that can help point patients in the right direction in terms of, food banks, finding a local food bank, or calling 211, for example. But when it comes to really local resources, it's probably going to be the most effective to be tailored by members of your team. But we're happy to help with identifying or helping to identify what resources we could help plug into those, and locating some resources for your patients as well.
Great, thank you, Nina. We had two questions around CareMessage's reporting capabilities, one from Connie, and then Karen, if you're still on the line, we did reply to request clarification on your question around KPIs. And in the meantime, if CareMessage could speak to our reporting capabilities, that'd be great.
Reporting capabilities, in terms of like what data they can pull from CareMessage? Am I interpreting that correctly?
Connie, if you're on the line and would like to clarify, that'd be great.
Okay, great. So yes, so for CMLight, the reporting capabilities, so the reporting capability is essentially the ability to download the outreaches that you've sent in those CSV files. The messenger feature doesn't have you don't have the ability to download those messages into a CSV file at this time. But that's kind of for CMLight, that is kind of the extent of the reporting capabilities, is the CSV file with all the conversations that have happened with your patients.
Great. We had another question on how long will the complimentary resources be available for getting the word out to our members?
Yeah, so we have no plans to take down the COVID-19 message library or the telehealth videos. We're constantly building off of them. So I think you're going to see those continue to expand. And then in terms of the CMLight, we're going to continue offering this as long as we possibly can, as long as this is still a challenging time for our health centers. So it's like I mentioned, it's a free 60-day trial, the no obligation, no long-term commitment from that. So yeah.
Great. And related to that question, we had a follow-up from Melissa. What is the cost of CareMessage after the 60-day trial?
So if the need for you and your team to continue using CareMessage Lite continues beyond the 60 days, then we're open to extending the amount of time that you all have the product for free. However, if you'd like to kind of formalize your partnership with CareMessage and come on as a full customer and get full access to our platform, the standard cost of CareMessage varies by the size of your patient population. But overall, it's roughly $1 to $2 per patient per year. So we don't charge by message, we charge by the number of patients.
Thanks, Orit. We had a question from Jerry that related to the beginning of the presentation, and it reads, and Jerry, hopefully this is the right characterization of what you're hoping to discuss, relating to the earlier part of the discussion and the issue of social distancing as it relates to our Hispanic culture of community and multiple people living in one household of several generations. Jared, we'd love to respond to this and have a dialogue around this. Curious if you could potentially clarify if there was a specific question you had in mind.
Yeah, I mean, while Jerry is clarifying, I think it sort of speaks to the fact that more communities are able to social distance if they have the privilege to do so. And so for a lot of folks who are low income or who come from certain cultural backgrounds, it's very normal to have a multi-generational household. So grandma's living at home as well as kids and as well as some working adults. And that then makes it hard to protect the community and to social distance. We also know that Density in urban areas plays a role in the ability of certain people having the privilege to social distance. Some people are forced to take trains to go to work, especially if they are essential employees. So that also definitely plays a role in the high rate of infections and fatalities that we've seen with COVID-19. So there's definitely a lot of you know, structural and societal forces at play here as well. But I also think that, you know, using CareMessage or using culturally relevant messaging to kind of enforce social distancing as much as possible to certain communities is really beneficial, and kind of explaining the benefit of washing hands if you don't have the privilege to social distance from your family, or taking certain measures if you have to take public transportation, wearing a mask, so on and so forth. So there are ways that you can acknowledge the fact that your patient population may not have the privilege to social distance, but that you can also take other precautions.
Great. We had a question from Andrew on, does any kind of permission have to be obtained from the patient?
So normally what we recommend at CareMessage is if a patient provides you with their phone number, then the assumption there is that they expect to be contacted. So we like to use the opt-out approach instead of the opt-in approach. So we suggest that you go ahead and message your patients, and we have built-in opt-out functionality in CareMessage. So you can always include something that says text stop to opt out, and the patient can always reply stop if they would no longer like to receive messaging. So we believe, and we can also work with you and your team to kind of tease out some of the compliance around this, but more often than not, patients would like to be contacted by their health center if they do provide that phone number.
Great. We also had a question on, do we have any messaging regarding infectious diseases? And a second follow-up asking a very similar question, infectious diseases, specifically STIs and TB.
Yeah, I think we do. I'm going to have to check our broader message library. We have like over 300 messages, and I believe we do have a whole tab that is dedicated to STIs that you would have access to. But yeah, maybe after I can double check, but I'm pretty sure we have a whole section dedicated to STIs, and it's just a copy and paste. They come in English and Spanish. And you can copy and paste it into the outreach feature.
Great, thank you, Nina. I am scanning the chat and the Q&A to make sure that I haven't skipped any messages. We did have clarification from Karen, who had the question on KPIs and reporting, and it looked like some of the insights that she was hoping to derive was understanding no responses, drop-off, success. Karen, I see a follow-up comment as well, and I'm not sure if that relates to the original question, but perhaps the CareMessage team can share what other insights you can derive out of the campaign reporting.
Yeah, so I can go ahead and address some of the reporting KPIs question. So this ultimately really depends on the type of message that you send and the call to action that you're hoping to get from your patients. So we recommend using the system and setting up messages in a way that works for you and your staff. So you can set out a message asking patients to call the clinic, and that will then result in your volume of call center calls going up. And so we've actually seen, health centers get their call centers overrun because they'll send out a care message to several thousand patients, and then patients will call back in to book an appointment or ask clarification questions. And so some people see that as a success metric and therefore stagger their messages to go out. Or if you want to ask a question for patients to get a sense of whether or not patients would like to cancel an appointment or book an appointment or follow up with you and your team for a specific purpose, you can kind of gauge your success metric based off of how many patients texted back yes to that. So there are several kind of types of messages that you can send, and I think that the success metric for that would depend on the message itself. Overall, when it comes to opt-out rates, so patients who choose to not be messaged after receiving a message, we usually see about 5 to 10% opt-out rates over time. So yeah, so I hope that answers your question, Karen.
Great, thank you, Orit, and thank you, Nina, for answering all of the different questions. If there are any questions that we didn't get to in the last few minutes, or if any questions come up over the next few days, please feel free to reach out to our team at the email provided on the slide right here, marketing@caremessage.org. We will, as promised, follow up with the resources that we discussed today, future training, registration, and webinar opportunities that we'll be providing as an ongoing resource, and we'll send that out to all registrants and attendees in the next coming days. With that, thank you so much, everyone, for attending today's webinar, and we look forward to seeing you at the next.
Thanks, bye.